Imagine this. It's bedtime, your child has just had a routine vaccine earlier that afternoon, and now they're burning hot. You're staring at the thermometer, heart racing, thinking, did I do something wrong? I get it. I've been the nurse on both ends of that moment. Let's separate medical fact from fiction. I'm Jessica Tagnani, and today we're going to walk step by step through what's normal after a shot, what's not, and exactly what phrases to use when you call for help. Before we get into the details, you'll find a downloadable checklist, translated versions, and the full transcript in the episode notes. A quick medical disclaimer. This episode is general advice, not a tailored medical plan. If your child or someone you care for seems seriously ill, please contact emergency services or your clinician right away.
First, in plain language, why do shots make us feel funny at all? Vaccines teach the immune system to recognize a germ. That education causes the immune system to get temporarily active. Locally, that looks like pain, redness, or a lump where the shot was given. Systemically, it can look like tiredness, mild fever, or achiness. Those symptoms are signs the body is responding. Uncomfortable, yes, but usually temporary and harmless.
Let's talk about local reactions, the ones at the injection site. Timing, most start within a few hours, peak around 24 to 48 hours, and begin to improve after that. Typical signs are soreness to touch, some redness, or a small, firm bump. Simple care. Use a cool compress for 10 to 15 minutes at a time. Encourage gentle movement of the limb rather than keeping it still. And acetaminophen or ibuprofen can help for pain if the person is able and it's appropriate for their age. If redness is spreading rapidly, the area becomes increasingly warm, or there's drainage or a fever that seems unrelated to the expected course, that's something to check.
Now, systemic reactions, fevers, chills, fatigue, muscle aches, most happen within 48 hours and settle in a day or two. I'll give conservative, plain number thresholds people can use at home. Infants under 3 months, if the rectal temperature is 100.4 degrees Fahrenheit or 38 degrees Celsius or higher, call your clinician or seek evaluation right away. For anyone aged 3 months and older, call the clinic if a fever reaches or stays at 102.2 degrees Fahrenheit or 39 degrees Celsius, or if a fever lasts more than 48 hours despite typical care. Those numbers are conservative guides. You'll find citation notes in the episode assets, and if you're ever unsure, calling your clinician is the right move. While we're on fevers, practical tips. Keep fluids available. Offer extra breast milk or formula for babies. Use light clothing, and prioritize rest. Avoid overdosing on fever medicines. Follow dosing by weight and timing. If medications aren't helping or the child won't drink at all, reach out to your clinician.
Next, allergic reactions versus normal side effects. This is important, so listen carefully. Normal side effects are the soreness, low-grade fever, and tiredness we just covered. Allergic reactions show up quickly, usually within minutes to a few hours, and can include hives spreading beyond the injection site, swelling of the face or lips, throat tightness, difficulty breathing or noisy breathing, wheeze, or feeling faint or very dizzy. If you see swelling of the face or neck, persistent wheeze, or trouble breathing, that's an emergency. Say to 911 or the triage nurse, "My child had a vaccine and is having trouble breathing and facial swelling. Possible anaphylaxis. Please send help." Those exact words help speed correct care. For clarity, hives alone without breathing difficulty can be watched closely, but if hives are spreading rapidly or you have any breathing, swelling, dizziness, or fainting, treat it as an emergency. If someone carries an epinephrine injector and the allergic reaction looks severe, use it and call 911 immediately.
Let's list red flags and where to send them. Call 911 if there's trouble breathing, severe persistent throat tightness, collapse or unresponsiveness, or repeated vomiting with signs of severe dehydration. Go to the emergency department if there's a suspected seizure, very high fever over 104 degrees Fahrenheit or 40 degrees Celsius, or rapidly worsening redness and swelling at the shot site with fever. Call your vaccinating clinic or primary clinician for fevers at or above the thresholds I gave earlier, fevers lasting beyond 48 hours, or concerning but not immediately life-threatening symptoms. When in doubt, call your clinic. They can advise and arrange in-person evaluation if needed. I want to share a short perspective from an emergency nurse I spoke with, paraphrasing her point in her voice. We often see parents bring kids in panicked because of fever alone. Fever is a sign, not a diagnosis. What matters is how the child looks and acts. If they're alert, drinking, and responsive, we treat supportively. If they're very hard to wake, struggling to breathe, or have a bluish tint or floppy muscles, that's when we need immediate action. I'll put the exact clip and attribution in the show notes for clinicians and curious listeners.
Now, plain language phone and portal scripts you can copy. One-line script for quick triage. My child had a vaccine today and now has a fever of 102 degrees Fahrenheit and is acting more sleepy than usual. Advice, please? Two-line script for more details. Hi, this is your name. My 3-month-old had a vaccine at 2 p.m. Today at 9 p.m., their temp was 102.1 degrees Fahrenheit by rectal measurement. They are drinking less and seem more tired than usual. What should we do next? For a suspected allergic emergency when calling 911, my child had a vaccine and is having trouble breathing and facial swelling. We may need epinephrine and emergency transport. Use these exact phrases. They make triage faster.
Tiny TLDR checklist for low literacy or high stress moments. Say this aloud if you need to. Check breathing, take temp, give fluids, use cool compress, call clinic if baby under 3 months with 100.4 degrees Fahrenheit plus, or any age with 102.2 degrees Fahrenheit plus, or fever greater than 48 hours, or if trouble breathing or swelling. Call 911. What should you document? Keep a timed symptom log. Note time of vaccination, time symptoms started, exact temperatures with method, rectal, oral, axillary, photos of redness or swelling, and medications given with dose and time. Clinicians and reporting systems rely on timestamps and photos. They help identify patterns and rule out unrelated events. Reporting walkthrough? Start by contacting the vaccinating clinic. That helps coordinate immediate care and reduces duplicate reports. Your clinic can guide local next steps and often files reports for you. If you need to report directly, national systems exist. I've linked them in the notes and included region-specific guidance. Important: avoid filing the same report in multiple systems without coordination. Duplicate reports can slow down public health review. If you're outside the U.S., check your local health department link in the episode notes. Accessibility and resources. Again, you'll find a printable checklist, translated checklists, the full transcript, and citation notes for the thresholds I mentioned in the episode notes. I made the language intentionally conservative, so families have a clear safety margin. Please see the citations if you want the clinical references. 3 concrete things you can do tonight. 1. Print or screenshot the TLDR checklist and put it on the fridge or on your phone. Put the one-line script somewhere easy to read. 2. Prepare a simple symptom log, a note with headers for time, temp, meds, and photos, so you don't have to think under stress. 3. Know your clinic's phone number and local emergency number. Save them in your contacts labeled clearly, clinic for vaccines and emergency. Those 3 steps make decision-making faster when you're worried. A final reassurance: vaccines are one of the safest preventative tools we have. Most reactions are short-lived, and the serious reactions are rare. Giving yourself a clear plan and a few scripted phrases reduces anxiety and helps you get the right care quickly if something uncommon happens. Thanks for listening. If this episode helped you feel more prepared, please subscribe so you don't miss future practical guides. Download the checklist and translations in the episode notes, and use the links there for local reporting portals and citation details. Until next time, stay informed, stay compassionate, and always put safety first.